Right. Hello, everyone. I'm Dr. Rendy Murphy, epidemiologist and director of disease surveillance and environmental services at the Mobile County Health Department. I'm here to give you the Tuesday, February 23rd update of the impact of the COVID-19 pandemic on Mobile County. I want to say a big thank you to Dr. Eishold for stepping in for us yesterday and giving our report. So, worldwide, we're at nearly 112 million cases of COVID 19 disease around the globe. Alabama is nearing 489,000 cases. With deaths, we're nearing 2.5 million deaths worldwide from COVID 19. And in the U.S., for the first time, we went over the 500,000 mark with regard to COVID deaths, 501,117 deaths in the United States due to COVID 19. So, still a very serious situation, a very serious, once in a lifetime, hopefully, pandemic that we are still in the midst of nearly a year and a month or two after first being recognized in the United States. So today on our daily report, we're reporting 35,829 cases of COVID-19. Chart looks a little crazy today because 348 cases were added, but we know that those came from one local urgent care. They have 4 or 5 locations around Mobile County, and even though those 348 were reported to us yesterday, that was some catch up by the urgent care, and the infectious date for those specimens ranged from February 3rd to February 22nd. So again, reported to us yesterday, but occurred in the days and weeks prior to yesterday. The number of died, the cumulative number of people who have died with COVID is 717. 8 were added yesterday. The number of people hospitalized in Mobile County hospitals with COVID-19 is up 17 to 4,600. And then yesterday, in the hospitals in Mobile, there were 110 patients with COVID-19 disease. So in general, except for this, artificial spike yesterday, we continue to see a reduction in the number of cases and the number of hospitalizations, and hopefully deaths are leveling off. So we published our weekly expanded report yesterday, and last week we recorded 493 cases of COVID. So that is the lowest number since November 15th. So we still have not reached the weekly number of cases. We've still not returned back to our lowest number of cases, which occurred in late August, early September, but it is getting pretty low. So good news for that. Please continue to distance from others, wear your mask, stay at home if you're sick or exposed. Don't go out in public unless you absolutely have to. So let's see other things from our weekly report that we sometimes comment on. The average number of people hospitalized on any given day, as we reported, is going down in the low 100s. That's really good news. The number of emergency department visits for COVID-like illness is down greatly, very close to less than 2% or so, which is good news. And last week we had, when we look at the number of deaths by week of deaths, we had 11 people die last week with COVID compared to 15 the prior week and 30 the week before that. So a pretty dramatic reduction in the number of people who are dying each week with COVID. The percent positive laboratory test, this is another indicator that we look at. In the statewide system, it's down to around 5%. If we just look at our clinics around town that are doing rapid tests, it's still up in the low teens percent positive, but certainly that is good news that it is also going in the right direction. So just to be clear, we still have several thousand tests performed each week. So the number of tests it is coming down slightly, but we still have plenty of test results to look at, and the percent positive results are going down. If you look at our map, it's kind of cool to look at it looking all yellow. We're not seeing some of those really high rates of COVID-19 like we had been seeing before. So again, just good signs that our community has, is getting past the enormous historic high number of cases that were reported in December and January due to, gatherings, sporting events, people getting, a lifting of restrictions on occupancy and those sorts of things. So again, we know those things are important, so please continue to do your part to keep our community safe and moving in the right direction with cases and hospitalizations and deaths going down. Let's see, there are just a couple of questions. One has to do with out-of-state, people who live out of state coming into Alabama for vaccination. We know that this happens. A lot of people in Mississippi get health care in Mobile. There are, areas in Dothan and in Northeast Alabama where people come from Tennessee or Northern Georgia to get health care in Alabama. We do vaccinate out of state, so the vaccine is a federal asset. Alabama does not restrict vaccine based on any geography, county line or state line, but there's a lot of interest in the number of people that we vaccinate who are out of state, and it looks to me like it is less than 2%. Another question about people who are traveling. So we get this question from time to time, people who maybe overwinter, maybe they spend the winter in Alabama along the Gulf Coast, and they're going back. Should they, would they be able to get their second dose once they get back to their state? Can people who travel because of their job get vaccine in Alabama if they receive their first dose elsewhere? The most important thing is that you go back to get your second dose where you received it, because doses are allocated, as a series. So we can't guarantee that we could give someone a second dose who was not vaccinated here. But keep in mind that the window for second dose vaccine is not exact. So we don't want you to get it early. We don't want you to get your second dose very early, but you have, 4 to 6 weeks, maybe even longer after your first dose to receive that second dose. So it may not be as crucial as some. The question that came from our vaccine site was about traveling nurses. Would they be able to get second dose with the health department if they receive their first dose while working out of state? And anyone that comes to our second dose clinic will be required to have their COVID vaccine card showing that they were vaccinated at the health department and, are due for their second dose. So people working in healthcare settings can contact local hospitals to see if they can, if they're traveling nurses, to see if they can get a second dose out of state. All right, a couple of things about clinics this week. We always talk about clinics. So this week we have 2 confirmed second dose clinics at the cruise terminal at 201 South Water Street. So if you received your first dose by the Mobile County Health Department at the cruise terminal on January 22nd, then you need to return to the cruise terminal Wednesday, February 24th between 9 a.m. and 2 p.m. Remember, bring your card. If you've lost your card or you forget it, then just be prepared to wait a little bit. We can look you up in our system to confirm that you got your first dose from us. So if you received your first dose on January 27th, return to the cruise terminal tomorrow, February 24th, between 9 a.m. and 2 p.m. If you received your first dose of Moderna from the County Health Department on January 29th, then return this Friday, February 26th, between 9 a.m. and 2 p.m. And let's talk again tomorrow about vaccine clinics, because we may be able to announce a first dose clinic this week, but we're still nailing that down, and we'll let you know for sure when we have all of our messaging straight on that. All right, and then the last thing I was just going to mention, we spent a lot of time talking about trends in cases and hospitalizations, a lot of talk about vaccines, but just want to remind you, in addition to getting vaccinated to prevent COVID, to wearing your mask and, socially distancing and staying at home if you're sick to prevent COVID spread, the other thing you can do to prevent COVID spread is get tested. So we still are really encouraging testing for anyone who wants to test. And just wanted to share that this past Sunday, the Mobile County Health Department did a drive-through, sort of drive-up testing event in collaboration with the Midway Missionary Baptist Church on Three Notch Road in Theodore. That was this past Sunday. We partnered with them to test several dozen of their congregants, and all of them were negative. So that's really good news. So just wanted to share that it still is really important that you get tested. Anyone can get tested at the health department at no charge by getting an appointment at 251-690-8889. So you don't have to be symptomatic, but you need an appointment to come to one of our clinics. And again, it's 251-690-8889. So I believe that is all for today. I'm getting the 2 thumbs up from Mark. So I'll leave you with those remarks today, and we will chat again. And hopefully we can give you an update on additional vaccine clinics sponsored by the Mobile County Health Department. So thanks, everyone. Stay safe out there.